Madam Speaker, I recently introduced the Newborn Screening Saves Lives Reauthorization Act, which will continue the important work of the original bill and expand its critical programs to improve infant health across the United States. Every year, thousands of babies are born with genetic, metabolic, hormonal, and functional conditions that severely affect their development. 50 years ago, these rare disorders in infants would have gone undetected until symptoms appeared, often too late to provide them with the essential treatment needed to prevent lifelong disability or even death. Today, we can give newborn babies a simple blood test that can identify such life-threatening genetic illnesses before symptoms appear. In 2008, Congress passed my original bill, which was a major step towards establishing newborn screening guidelines across the United States. Until that time, only 10 states and the District of Columbia required newborn screening for a complete panel of recommended disorders, and there was no federal repository of information on these diseases. Today, 49 states and the District of Columbia screen for at least 31 of the 35 currently recommended core conditions. Each year with newborn screening, healthcare professionals identify approximately 12,000 babies who test positive for one of these rare conditions. This invaluable early detection allows for timely treatment to prevent long-term damage and severe health complications, which gives babies the opportunity to live relatively normal and healthy lives. For thousands of mothers and families, this early and simple intervention can also reduce the emotional stress of trying to identify their baby's correct diagnosis. Investments in newborn screening can also save up to $1 million over a child's lifetime. This is a significant savings for American families and our financially burdened healthcare system. While it is true that since the original passage of the Newborn Screening Saves Lives Act, significant advancements have been made in early detection and treatment, serious gaps in newborn screening remain. The Newborn Screening Saves Lives Reauthorization Act will build on the current newborn screening infrastructure and strengthen early detection of preventable disease. To ensure the quality of laboratories involved in newborn screening, the bill reauthorizes the Centers for Disease Control grants, and it continues HRSA's grants to empower parents and health professionals with education and resources to improve newborn screening. The bill also renews the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children, which maintains and updates the recommended uniform screening panel that states adopt and implement. The bill funds research to identify new screening technologies and treatments, and a new provision in the bill commissions the National Academy of Medicine to issue recommendations to modernize newborn screening systems into the 21st century. The Newborn Screening Saves Lives Reauthorization Act will continue to ensure that parents and health providers are knowledgeable about the value of newborn screening, and it will help ensure that infants across the United States receive comprehensive and consistent testing. A coalition of public health groups, including the March of Dimes, the Association of Public Health Laboratories, the American College of Medical Genetics, and the National Organization for Rare Disorders, support the Newborn Screening Saves Lives Reauthorization Act. Their leadership has been critical to advance newborn screening across the United States. Madam Speaker, newborn screening is one of the most important public health interventions of the 20th century, and it is critical that in the 21st century we continue and strengthen the programs and research of the Newborn Screening Saves Lives Act. I urge my colleagues to co-sponsor the Newborn Screening Saves Lives Reauthorization Act to enhance the lives of hundreds of infants and families each year in the United States. I yield back.